Welcome to my TED Talk. This is Emily Gracia, and today I will share my story. Picture a child around 6 years old. What do you imagine? Maybe a child playing with toys, starting school, learning to read, and making friends. Now imagine that same child not laughing or playing, but struggling with thoughts of death and questioning about whether life is worth living. This was a case for one of my youngest clients I have encountered as an intern with San Bernardino County Community Crisis Response Team. This child, just 6 years old, was already experiencing suicide ideation. At 6, they didn't fully understand what death meant, but they knew enough to express feelings of wanting to end their life. As shocking as it is, this is not a rare incident, it's a reality that many professionals like myself are encountering more and more. Childhood suicide is a growing crisis. The question we have to ask ourselves is how can we intervene early enough to save these lives? Let's take a step back and look at the bigger picture. In the United States, suicide is the second leading cause of death for children and adolescents ages 10 to 12. No, I mean 19. But what about children younger than 10? While it's rare, cases of suicide and suicidal ideation in younger children are on the rise. Studies show that even as young as 5 years old, children can experience depression, anxiety, and trauma, issues that, if unaddressed, can lead to devastating outcomes. During my internship, I have had the privilege and the challenge of working with children and families in moments of crisis. From self harm to suicide ideation, these cases underscore the urgent need for tools that can identify and address mental health struggles early. One of the most important lessons I have learned is that children in crisis often don't have words to articulate their pain. They express it through behavior such as withdrawal, acting out, or even silence. Recognizing these signs is crucial, and so is having framework to respond effectively. That's where SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment, comes in. So, what is SBIRT? SBIRT is a public health intervention originally developed to address substance use disorders. Over time, its use has expanded to mental health, including pediatric settings. It's simple, adaptable, and effective, making it an excellent tool for addressing childhood mental health crisis. Here's how SBIRT works. So, SBIRT, the S stands for screening. During routine interactions, whether it can be at a doctor's office, at its school, or even an emergency room, children are screened using age-appropriate and evidence-based questions. For example, a pediatrician or even a medical social worker might ask, have you been feeling sad or worried lately? Or do you ever feel like you don't want to wake up in the morning? So that's as for screening. Now, the B in SBIRT stands for brief intervention. Brief intervention is if a child shows signs of distress, the provider engages in a short and focused conversation. This step is critical because it's an opportunity to explore the child's feelings, validate their experiences, and offer immediate support. Now, the R is referral to treatment. So finally, if the screening and intervention reveals significant risk factors, the child is referred to specialized mental health services that can be with a therapist, with a psychiatrist, or even placing them in a 5150 home. So this ensures that they get the help they need before the situation escalates. One of the strengths of SBIRT is that it doesn't require a specialized mental health provider to implement the initial steps. Teachers, school counselors, or primary care doctors can be trained to use it, making it accessible in a variety of settings where children spend their time. So, now let me share you a story. During my internship, I worked with a young boy who was referred to us after expressing thoughts of wanting to disappear. He was only 7. His teacher noticed he had become withdrawn, often sitting alone during recess and refusing to participate in class. Through a brief intervention, we discovered that he was struggling with feelings of rejection at home and bullying at school. The teacher's decision to ask a few simple questions made all the difference. He was connected to therapy, where he began learning coping strategies and building his self esteem. Now, without that early intervention, his situation could have been worsened. This is the power of tools like SBIRT. It teaches children before they fall through the cracks. Now, let's talk about culture. As American myself, I have seen firsthand how cultural norms and stigma can prevent families from seeking help. In many communities, mental health struggles are seen as private matters or even signs of weakness. Parents might hesitate to seek help for their child, fearing judgment or misunderstanding. To make interventions like SBIRT effective, they must be culturally sensitive. This means conducting screening in a child's preferred language. That can be Spanish, Tagalog, any other language, even sign language, involving family members in brief interventions or addressing cultural beliefs about mental health in a respectful way. For example, in my internship, I have worked with families who initially resisted mental health services. By taking the time to listen to their concerns and frame the interventions as a way to support, not judge, their parenting, we were able to build trust and get their children the help they needed. Now, despite its effectiveness, implementing SBIRT isn't without challenges. Many providers lacking training in mental health screening, especially for young children. There are also a shortage of pediatric mental health specialists, which can delay referrals. But these barriers aren't invisible. With better funding for mental health training, more schools and clinics could integrate SBIRT into their routines. Advocacy is also key. Educating policymakers about the importance of early intervention can help secure the resources needed to expand access. Now, what has this taught me? So, throughout my work, I have learned that children in crisis often just need one adult to notice their pain and take action. It's a reminder of the importance of presence, of being fully engaged when a child is struggling. I have also seen the power of listening without judgment. That can be not making facial expressions or just simply how you're responding after they express themselves. Because many times, children and their families simply need someone to validate their experiences and offer hope. Finally, I have learned that no intervention works in isolation. It takes a team: parents, teachers, social workers, doctors, and mental health professionals working together to support a child. So, what can you do? Whether you're a professional, a parent, or simply someone who cares about children, there are steps you can take. So, some steps is advocate for mental health, screenings in schools and pediatric clinics. That can mean that once a year, a the student gets evaluated, and that can be simply with a counselor, just getting evaluated to see how their mental health is, whether they're being bullied at school, or if they have problems at home, any trauma that is affecting their um their schooling and being able to focus. Another way that we can help address this issue is by educating yourself and others about the signs of childhood mental health struggles. That can be, like in this case, it can be withdrawn, isolation, not wanting to talk to your parents or any siblings at home, locking yourself in, or locking yourself in the room, um, and then not playing in recess. Also, it can be another step can be support policies that fund early intervention programs like ESPERT. So when it comes to voting, it's important to vote policies and advocating for policies like these because it can help decrease the risk of suicide, especially on children. And most importantly, take the time to listen. You might be the person who notices when no one else does. It can be so easy to ignore someone that you might think they need help, but just by ignoring them, you're already letting that person struggle by themselves. So it's so important to just listen. It can change someone's life but by just simply asking them how they're feeling. So take the time to listen. And finally, children are resilient, but they're also vulnerable. When we take the time to notice their struggles and intervene early, we can change the course of their lives. Tools like Esper give us a framework, but it's our compassion and commitment that make the difference. Thank you.